Welcome to the Global News Podcast. And on this edition, we're going to hear from our South Asia correspondent, Yogita Limaye, who's just returned from Afghanistan and has produced what I think anyone who's seen it will agree, Yogita, is a very harrowing report about poverty and starvation in the country. First of all, just give us a general impression of the situation there.
So in the past 4.5 years, we've been there quite a lot since the Taliban took over the country, and we have seen the situation really deteriorating. There are some numbers from the UN which say that the winter gone by has pushed 4.7 million people. And just to give you a sense of what the scale of that is, basically it's more than a tenth of the population into emergency levels of hunger. This is what the UN calls is just one step below famine. The UN also says that 3 out of 4 Afghans can't meet basic needs. And when you look at what they define as basic needs, it basically means food, access to healthcare, access to livelihood, so jobs. And that is what we have seen on the ground. It's really, really hard to find work in Afghanistan right now for daily wage laborers. And that is kind of triggering all of the other problems, which is a crisis of hunger. The UN calls it, the WFP, the World Food Programme, calls it record levels of hunger and malnutrition that are now being recorded in the country.
Well, that's the statistics. As you say, you were there on the ground reporting and met some people in really terrible situations. Perhaps you'd like to tell us about some of those people.
So first, one of the places that we went to was really early in the morning in the center of a town square in Chaghcharan, which is the capital of the Ghor province in central Afghanistan. That is where, if you're a daily wage laborer and you want to find work, that is where you come to in the morning. And they were stood there hoping that somebody, a contractor, somebody comes by offering some work for the day. Out of hundreds of people that we saw gather at that square, 3 people got a job in the 2 hours that we were there. We spoke to people and said, how many days of work have you had in the past 4 weeks, 6 weeks? And the answer was 1, 2, 3, 4, 5. The wages were, anywhere between 150 to 300 Afghani, which would translate to about $2 to $5, £1.5 to £3, I imagine. And what that's doing, and every single person there said to us, what we eat is dry pieces of bread and either hot water or hot tea. And in Afghanistan, hot tea is not, is not tea with milk and sugar and anything that has nutritional value. It's basically hot water with green leaves. And all of them said there are days when their families have had to go to bed hungry. They've said they're really mentally disturbed. It's causing them a lot of stress. Some said, we've even thought about killing ourselves, but then we think, how will our families then carry on? And so we are back here in our daily attempt, really at survival, trying to find a job.
This is very interesting because, you've talked about the possibility of famine, you've talked about widespread starvation, but you're talking there about what I suppose we should call unemployment. And I guess some people will hear this and say, well, look, is it a shortage of work or is there an overall shortage of food in Afghanistan, or are they effectively the same thing?
There isn't a shortage of food availability as such. There have been issues because, there are more than half of all provinces have suffered from drought. So I think there have been issues in terms of agricultural production. So the availability of, actual food being there in Afghanistan. But this is a situation where people really don't have the money to buy food, which is where aid agencies were extremely crucial because they were supporting millions of people with food handouts, things like, lentils and sacks of flour, cooking oil, things like that. And because people now, they don't have work, they don't have money, they can't buy food, that is leading to a crisis of starvation among their families. We've profiled 2 families where they told us that they would be willing to sell their children so that their other children can eat. But really, it wasn't just these 2 families. It was widespread. In so many places that we went to, we were asked, do you know any merchants? Do you know anybody who would buy a child? And these are decisions, or these are things they are saying after having sold everything they could in their home. So whether it's a carpet, it's a rug, a pressure cooker, literally every last thing that they could sell. And then they've reached the stage where they're going for days without food. And that's why, they're pushed into trying to think of these unbearable decisions.
Now, you mentioned that there were aid agencies that were keeping the food supplies going and that they're not doing so anymore. Why is that?
Well, so they are there. They are still operating in the country, but their operations on the ground have become challenging because of two main reasons. The first thing is they need the funds to actually be able to give people that food aid. That funding it's seen massive, significant cuts in the past few years. So we've just had one of the top bosses of the World Food Program who was in the country and who said, like, we actually have to turn 4 out of 5 families away because we don't have the resources to feed them. And there are millions who are going hungry and who will not survive because of that. Again, just to give you numbers, last year, the US cut nearly all aid to Afghanistan. This was after the Trump administration came to power. That contributed nearly 43% of all foreign aid that was coming into Afghanistan. If you look at the UN's figures this year, and obviously, we're only about 5 months into this year, but if you look at the funds that have been committed or already given to Afghanistan, that number is about 70% lower at this stage than last year. Maybe more funds could be given in the future, but it's a really sort of staggering cut at this stage. And while I've obviously talked about the US, it's not just the US. There are other European nations, including the UK, which have also cut aid to the country. There's other donors which are walking away as well. And while, some of that is triggered because of their own domestic factors and their domestic economies and what's happening around the world, there is definitely an element of the Taliban government itself and its policies and its restrictions. And, people don't necessarily want to be engaging with a government which is denying basic human rights to half of its population, its women and girls. And the other thing is, because, the diktats that the supreme leader has passed since they seized power in the country. So back in 2022, Afghan women were banned from working for domestic and international NGOs. Now, this is not a ban that is necessarily uniformly enforced. And there are many places where actually, at least in field offices, women can go and work. But once the diktat exists, the operations do become more difficult. There can be, a Taliban inspector who comes and says, why is this woman going out to work? And women are extremely crucial to being able to reach women and children in the country. So that is another reason why it's become extremely tough. And while we're on that issue, actually, I just want to quickly add that since September last year, Afghan women have not been able to access the main UN compounds in Kabul. And, they've been working to try to resolve it with the Taliban government, but so far there's been no resolution to that issue.
You also, in your report, had some very harrowing scenes from a hospital where it seemed they just weren't able to provide the kind of healthcare that people desperately need. How serious is that situation?
It's like a vicious cycle, isn't it? You've got the aid has stopped. There's no work. People aren't able to feed their children. You're having mothers who are malnourished. The children are born weak and low on nutrition. Again, you aren't able to feed them. And then you've got large numbers of people showing up at hospitals, which aren't able to, even the best hospitals in the world would struggle to cope with that load. And you've got these severely depleted medical facilities trying to deal with that. So prior to 2021, this is when the Afghan sort of republic government was in power for 20 years. Nearly all funding for public healthcare infrastructure in that country, so all public hospitals, nearly all of that came from foreign aid. This was never kind of a self-sustaining system. When the Taliban took power in 2021, that stopped because you couldn't give the money directly to the Taliban government because they weren't internationally recognized. There were leaders among them who have sanctions against them. And so what basically happened for a bit was the money was channeled through humanitarian agencies on the ground. So we actually had, we had a situation, and it still continues, that doctors and nurses, their salaries actually, in some places are being paid by NGOs. They're actually being paid by humanitarian agencies who never used to do that prior to 2021, but they had to kind of step in to do that. But again, with the funding drying up, with aid cuts, that's affected public healthcare as well.
I suppose I'm left asking myself, is this much worse than before, or is this just a continuation of what you saw on your other trips?
Well, it's a continuation, yes, for sure, but it's also, it is exacerbated now, and you see that. I mean, in the desperation with which people talk to you, what they say they're eating. Like this time, I've heard kind of the dry bread and tea. This time, I even heard like there were families who said, well, it's dry bread and hot water because we don't even have the green leaves for the tea anymore." There was a bakery owner who, at that same square that I was talking about, where the men had gathered to try to find work. He sort of opened his bakery and he had a few stale pieces of bread, and literally within seconds they were ripped apart, and there were men holding on to pieces of it. So you kind of see that growing desperation, and obviously you've got to tally that against some statistics, because our evidence is obviously anecdotal. We're only able to be in so many places, and so everything that is coming from the agencies that are operating on the ground, and it's not just UN agencies, it's other international organizations as well, say this is now kind of a record levels of hunger and malnutrition.
Yogita, thank you very much indeed. That's Yogita Limaye, our South Asia correspondent there. Thank you for watching.